Fans of actor Luke Perry were shocked to learn this week that the 52-year-old actor had died after suffering a major stroke over the weekend. But what may be more shocking is that this province has the highest instance of stroke compared to the rest of the country. And strokes among people in their 50s have increased by 24% in the last decade. So what are the signs of stroke and how can we protect ourselves from it? Well, joining me is Jonathan Kirby. He is the Manager of Government Relations and Health Promotion of Newfoundland and Labrador for Heart and Stroke. Mr. Kirby, thank you so much for coming in.
Excellent. Thank you for having me.
Luke Perry's death from stroke certainly took an awful lot of people by surprise, mainly because he was just 52 years old. So when we usually think of stroke happening, we think of it happening to much older people. How common is it for people in their 50s or even younger to have a stroke?
It's becoming more and more common as we collect data around different types of stroke throughout the province and in the country. And you can see people into even their 40s and their 30s having strokes, and it's really, there's no age on how a stroke comes up.
So why is this province leading in stroke cases?
A lot of it has to do with lifestyle, and we all know that nutrition and activity are some of the biggest indicators and stuff that we can help prevent not only the signs and symptoms of stroke, but actually from strokes occurring, and helping people live a healthier life is one of our mandates.
How deadly is a stroke?
It can be very deadly, and literally has to do with time and making sure that people get the right care at the right time and as immediately as possible.
So what are the signs then of a stroke?
The signs we have an acronym called FAST, and the F stands for face, if the face is drooping on one side. A is for arms, making sure that you can hold them up, and if you can't, you need to get to emergency services right away. S is for speech, if it's slurred or jumbled. Then T, it's time to call 911 immediately and get to the nearest hospital.
So what happens if you only have one of those three symptoms? Should you still go to the doctor, go to the hospital?
Absolutely, and what we're seeing and what we're hearing on the ground is that people actually will not go to the hospital or care center if they only have one sign and they think it's a nuisance, they don't want to bother anybody. But we find that making sure that even if you have one of those symptoms, that you get to the nearest hospital right away.
Is stroke different for women than men?
It is in terms of research and in terms of care treatment. A lot of research has been focused on men and stroke happening to men as well as in heart disease. And the instance, like I said, of women not coming forward and thinking that it can be a nuisance to have this happen is that we encourage all women to check with their doctors and make sure that they are protected and safe.
Are there any, other than FAST, other than those symptoms that you're having while you're having a stroke or could be having a stroke, are there signs that you can look for weeks or months in advance that we should all be aware of?
The research hasn't suggested much right up front, but what we end up seeing from our national colleagues is that milder versions of the signs and symptoms of stroke, they often present most severe when it happens, but that even if your face is drooping slightly or you find some arm mobility movement is lacking or your speech is jumbled, and you find your friends and family may notice this or you notice this in your loved ones, that is to check with your doctor immediately, and if you feel that they're severe enough, make sure that you call 911 and get to a hospital.
And Jonathan Kirby, if people want more information on stroke, where can they find that?
We always like people to go to our website, heartandstroke.ca. You can find a lot of information on resources as well as programs available throughout the country. And we invite people to actually take our risk assessment available to make sure that they know the signs and symptoms and as well as their risk factors for heart disease and stroke.
Jonathan Kirby, Heart and Stroke Foundation, thank you so much for coming in.
Thank you.